ECDC On Air,
the podcast of the European Centre for Disease Prevention and Control.
Keeping up to date with European epidemiology.
Hello and welcome to ECDC On Air, the podcast for the European Centre for Disease Prevention and Control. I'm your host Nicholas, and today I'm joined in the studio by the ECDC Director Andrea Ammon. Andrea has a long career at ECDC, having started at ECDC as Head of Surveillance already in 2005. Since 2015, she's been the director of the centre, but will soon be retiring. In this episode, Andrea Ammon reflects on her time at ECDC and how the organisation has changed over the years, what it was like to manage the centre during the COVID-19 pandemic, and what kind of ECDC she would like to see in the future.
So, welcome to ECDC On Air, Andrea. Very happy to have you here again.
I'm happy to be here again.
So, I think this is actually the fourth time, if I'm not mistaken, that you've been here on the show.
Could be.
Yeah, and this is most likely the very last time, because you're retiring in only a few weeks' time from now.
Exactly in 3 weeks, yes. And it is probably the last time.
So I want to turn the clock back to the year 2005, which is when you first started at ECDC as Head of Surveillance. It must have been a very different organization back then. Can you describe a little bit these early days?
It was like a startup. We were very few. When I came, we were like 12. And everybody chipped in. So everybody sort of did what was necessary to be done. So in a way, we built the plane while flying it already. Because in October 2005, we had to deal with avian influenza for the first time as ECDC with avian flu H5N1. So we had no procedures. We had not even an own building at the beginning. So we were given a floor in the city hall of Solna. And only in October 2005, we moved then in our building, which we left then in 2018 for the current one.
That's interesting. So now we're in 2024. How has it changed, would you say?
Well, I think, first of all, we became a more mature organization with all the pros and cons. The cons predominantly that we have more processes and procedures, some say more bureaucracy, yes, of course. But it's also more consolidated in our setup. Stakeholders know what they can expect from us. So it's particular, I think, through the pandemic, we gained more visibility. Our opinions have now more weight. And that brings, of course, also more responsibility for us. Because while we were happily working in the background, happily or unhappily, there was not so much attention paid to what we said and how we said it. What we said, yes, but not so much how we said it. Now every word is scrutinized. And that also means that we have to be careful what we're actually writing in our opinions. All in all, I think we made really a jump to another level. We are recognized globally more and definitely in the EU.
Definitely. So do you think this is all down to COVID-19, or is it more like the kind of natural evolution that we are getting bigger?
Maybe we would have achieved this visibility and this better recognition also without COVID, but certainly not as fast. So I'm pretty sure the pandemic helped us.
Helped accelerate this, for sure. Okay. You touched upon it. I mean, ECDC has been, obviously, during the pandemic, extremely central in Europe in terms of surveillance, providing public health guidance, being a very, very central actor in the COVID-19 pandemic response. Do you think that ECDC has found its natural place now within the European public health infrastructure?
I think we certainly claimed our space. There are now new actors also on the field, like with DG HERA. Other actors have also new mandates, like EMA. And new challenges are also coming up, where the distribution of tasks has always to be discussed. But what I see and hear is that many colleagues in member states are telling us that our guidance is the basis for their guidance, even though they may adapt it to their context, but they're always looking, what does ECDC say? And that's kind of what I wanted to see, that countries, when they have a problem or an issue in infectious diseases, that they say, let's see what ECDC says. And I think we are closer to that now.
Okay. Do you think that we should be striving towards keeping a higher profile already than what where we're at the moment?
I mean, as the EU competence in health is subsidiary, and the responsibility for measures to be taken and policies to be implemented is the responsibility of the member state. We have to tread carefully as to not overstep the line. And if we are going too far, member states don't hesitate to point this out to us very clearly, that they're not happy with us going in this direction. So we had a few occasions also during the pandemic where we tried to be a bit more clear and outspoken, but they made it very clear that they think it's their remit and we should be more in the options area. Now with the new mandate, it's clearly said that we can issue recommendations. They're still non-binding, but at least it's recognized that what we say has a higher weight.
And if we do a little bit of crystal ball gazing, now we're 20 years into the history of ECDC. If we look at the next 20 years, do you have a vision for the future of ECDC?
When I started my term as director in 2017, my overarching goal was to make ECDC future-proof. What I mean with that is that I think ECDC should be proactively scanning what will come in terms of pathogens or diseases. So that's what we're doing with epidemic intelligence, with our foresight, for instance. But also looking or keeping track of the technological, environmental and political developments to see what could these mean for infectious diseases and for our work in the future. And I think we have now implemented a few elements, as I mentioned, with the foresight, with better international reach, more contacts with our partners around the globe, even further than we had before the pandemic. So I think we made progress into this, because what I anticipate is that the challenges will continue and they may come in shorter intervals. Not necessarily like a big pandemic as we had, but still challenges that we and the colleagues in the member states dealing with public health may face, and we have to react quickly.
Sure. And if we take a look back now, over the last 8 years you've been director here at ECDC, there's been many things happening at the center since you took on that role. Can you tell us about the most challenging part of your job as director?
Most of the challenges that are always there were more prominent during the pandemic. One of them, and for me, the one that is most in my mind, is really dealing with uncertainty. That was very clear. Some people have a hard time doing that. Not only our stakeholders outside, but also colleagues inside. So in particular, when we had requests for guidance where we had no evidence and we still needed to say something, and colleagues were really hesitant.
Was this particularly during the COVID pandemic?
Yes, it was particular during the pandemic because the need for our stakeholders to get our guidance was so high then, the pressure was so great. I mean, there is uncertainty also in non-crisis times, but then you have other ways to defer. You do a public consultation or an expert group. During the pandemic and a crisis, you do not have the time to do this. So there, the pressure was much higher. So that was something. Then the other challenge was really defending our scientific independence. We were not under as much pressure as other public health agencies in other continents. But still, that was sometimes an issue to defend the independence, also in the range between what the EU wanted and what the member states wanted, to find a good balance there.
So you felt that there was political wills that were trying to pull ECDC in different directions away from its scientific independence.
Exactly. And that required sometimes really to put down and say, look, this is what we can say. And everything else would be politically influenced. And that was, I think, usually accepted.
Do you think that ECDC managed in the end to maintain this?
I think nobody ever questioned our independence. And that, I think, is a big achievement. Other challenges were, in particular, also during the pandemic, to manage the tension between the overwork for staff and the need for our stakeholders to get responses. That was often not easy. And in general, really to manage the expectations from all sides, political, the public, internally, and to be very clear what everybody can expect.
Indeed, it must have been extremely difficult to keep up because things were happening so extremely quickly, and just being able to keep up with the onslaught of all the different events that were happening at the time and being able to be at the forefront there with sound advice, as you're saying as well, not being swayed by political influence and so on, must have been a very tough challenge.
It was not easy. And the good thing was that we had divided the work internally into several areas and that kept track in whatever was happening in their area. So that helped.
What has been the best moment for you? What are you most proud of?
If you talk about a moment, then I have to go back right at the beginning. When I started as head of surveillance, my main task was to transfer the existing surveillance network, 17, to ECDC and put all their data in one database compared to 17 as they were. And it took some time also to establish the database. But then in 2008, we had for the first time the annual epidemiological report, which contained all the infectious disease data that are notifiable at EU level for the very first time in one report. Although this is now an outdated format, at that time, it felt really good. Everybody has contributed to that, and it felt good because everybody was also very happy about this. When you go into the library and you carry this report, I think it's like 2 kilos. It's so thick. So anyway, that felt very good. And the other thing, but then it's really, as I mentioned before, it's the trust in our scientific work. I'm very proud of this, that nobody starts questioning the independence and the soundness of our advice. And that is due to the diligence of our colleagues here that are working here, who are really guided by the principle of evidence-based recommendations. And that, I think, shows. And in general, the recognition for our work with the new mandate and the additional resources, I think, is also very good.
Being the director of ECDC during the COVID pandemic, I mean, it must have been an extraordinary experience. Just a bit curious, what was it like? What moment did you realize that something huge was about to happen?
As soon as we heard that the virus is transmissible from human to human, and even more so when we heard that asymptomatically infected persons can transmit, it was very clear that there will be no easy way controlling this, if at all, as long as we don't have a vaccine or a drug. That was the moment where it became clear it's very difficult to bring this under control.
And what was your feeling then?
Well, it came gradually, you see. It didn't come with one bang, but it came gradually. And at that time, we had the example from China. They have put million inhabitants cities under lockdown. Everybody thought still in Europe we will not be able to do this, until the Italian colleagues in the north of Italy did that. From that moment onwards, we said, well, this is at this stage, when there's nothing else, the only way to really stop the transmission, the spread in the population, and make sure that the hospitals can still cope with patients that have severe disease.
And I think for everybody who lived through it, it was kind of an unsettling, quite scary experience there in the beginning. I assume people here at ECDC felt the same as well. How was it for you? How did you deal with the stress that it involved?
I have to say, at that moment, there was no time to think of, and for me at least, to think of me personally. I was a bit worried about, of course, as everybody else that wasn't with their families, what's happening to them. But I think in general, it was more that we said, well, for population, what is it now? What has to be done? And it was very clear that we have to, we called it flatten the curve, meaning we saw a steep increase, and the goal was really to slow down this increase. We knew we couldn't stop it completely, but at least slow it down so that the healthcare services could cope with the amount of sick people.
Mm-hmm. Are there any other outbreaks or health crises during your time at ECDC that you dealt with that you remember very clearly?
Well, I mean, it was from October 2005 when we had H5N1. At that time, we didn't have in the EU any human cases, but there were human cases in Turkey. So colleagues from us had the first deployment there with WHO. And otherwise, it was sort of the cooperation with the veterinarians that came out of this, and also the plan to visit all countries and go through their influenza pandemic plans with them. That was the outcome of that. So every crisis that we had some outcome for us that helped us to be better. The 2009 pandemic was overall, I have to say, also from our perspective, it was quite mild. I mean, we learned how to set up surveillance quickly, and unfortunately, it didn't have a massive impact into preparedness because everybody could deal with it in a way. Unfortunately, it didn't start the thinking that we need to invest in preparedness. 2011, there was this big ESTEC outbreak.
Can you explain what that is?
ESTEC is a Escherichia coli bacterium that produces a toxin that can produce diarrhea, but also especially in very young people, in children, and in older people, hemolytic uremic syndrome. So really a severe condition. And in that case, we had many, many people affected with hemolytic uremic syndrome. And we discovered that in these cases, we also need clinical networks, not only with public health and epidemiology, microbiology, but also with clinicians and pediatricians. So that is something that we put in place, but I'm not sure we have really kept it up. And then for the other thing that is really in my mind is the Ebola outbreak, 2014-15 in Africa. And there it was the first time for us to have a deployment of our staff, EPIAT fellows and member state experts at a grand scale for outside EU, which now the EU Health Task Force is kind of continuing and picking up.
Mm-hmm.
I mean, there are more.
Of course, there's so many different things that have happened in the history of ECDC. Yeah, but thanks for giving us a little bit of information on that and how you felt during those moments. Is there any kind of looming health threats that you think Europe needs to watch out for?
Well, we have one that's not looming. It's there. It's antimicrobial resistance. It's not as, visible as the pandemic was, but it's equally threatening, in my view, if not more. And that's there, and it's not going away. We need full attention to this. And I equally think that the lack of confidence in vaccines is very disturbing. And in a way, both antibiotics and vaccines were the two big achievements in the last century that brought infectious diseases down. And now we see one is overused, the antibiotics, and the other one is not used enough, that's the vaccines. So we don't see the full effect anymore. So I think here we also have to pay very close attention. And then, of course, diseases connected to climate change, they will warrant very close monitoring.
Absolutely. There we see things like invasive mosquito species, for example. Anything else you want to mention?
For instance.
Yeah.
And what we see is that for now, the mosquito species are detected further and further north, not yet infected, but still the vector is there. And then it's only a matter of time once the viruses also come.
So would you think that the next pandemic will be a zoonotic pandemic?
In the past decades, 75% of new pathogens were zoonotic. So I don't think it's difficult to imagine that the next pandemic also might be zoonotic. But I think we should also be clear that it's not sufficient that you have a zoonotic pathogen that infects a human. That is already the start of a pandemic. The pathogen needs to adapt to humans and then also acquire the ability to spread easily from human to human. Then we have a big issue.
How do you think policymakers and legislators today perceive the role of public health in Europe? Has it moved much further up on the agenda now?
I think it's already, unfortunately, moving down again. There are other demands on the political attention. The pandemic is now behind us, and I had hoped that the intensity and the extent of damage that the pandemic did would allow continued higher attention, but it's slipping. And I think the good instrument that we have now with our new mandate are these assessments that we have to do every 3 years in every member state, where we look together with the colleagues of this member state at their state of preparedness and check where they are compared to their self-assessment, compared in the coming years also to the action plan from the previous assessments. And this is where I think we can help to keep that for the attention of the policymakers, because we say, look, if you really want to be better prepared next time, this is where you have to invest.
So now it's less than a month until you retire. How does it feel?
I have been working now 37 years in infectious diseases, and it was an incredible journey. When I look back, now it looks like a directed path from the local health department to the federal state Ministry of Health to the National Public Health Institute and the European level. It wasn't like this when I went there, but it was a logical path now. And I have so many good memories despite all the crises that we had. I have met incredible people, and I feel that I am very fortunate to have had a field of work that, occupied me every second, and I have not a moment boring.
And what are your future plans now after you retire?
Yeah, I think, as I said, my time with infectious diseases is now sufficient, and I will do something completely different. I will move to a rural area in Bavaria and at a place where there's not so much light, and study astronomy.
That's very interesting. Here you have plans to even buy your own telescope.
Yeah, they come in different sizes, so I can adapt it to the place where I will live.
Has this been an interest of yours in parallel to public health all the time, or is it something new?
I got my first book on the universe when I was 11, and I was already then fascinated where the border of the universe is and what is behind it. So it has been sleeping and being awake and sleeping and being awake. So I haven't occupied myself in parallel with infectious diseases. I actually devoted all my attention to infectious diseases. But now I feel it's time to give it more space.
Okay. Well, many thanks, Andrea, for joining us here on ECDC On Air again for this final time. I wish you all the best in your future endeavors, your astronomy, and hope that your life will be enriching and rewarding, just as you've described your time at ECDC.
Thank you so much, Niklas.
We hope you enjoyed this episode of ECDC On Air. For more information about ECDC and his work, please visit our website or follow us on social media.